Does your knee ache every single time you walk down a flight of stairs? Do you feel that deep stiffness the moment you try to stand up from a chair, almost like your knees completely forgot how to move while you were sitting? Have you started avoiding squats or bending down because you are genuinely afraid of making things worse? And do you ever feel a little unsteady on your feet, like your knees just are not giving you the support and confidence they used to? If any of that sounds familiar, you are absolutely in the right place today. There are simple, effective exercises that can bring you real, long-term relief and support healthier, stronger knees well into your 60s, 70s, and beyond. I am Dr. Michael Turner. I have spent years helping adults over 50 move better, feel better, and get back to doing the things they love without that constant worry about their knees. Today, I am going to walk you through 5 simple exercises and explain every detail so you can do them safely, confidently, and correctly right at home with nothing more than a chair, a wall, and perhaps a light resistance band later on. Let us get right into it. We are counting down from 5 to 1, and each exercise builds on the last. Exercise number 5. Seated knee extension. This is one of the most commonly used exercises in physical therapy and knee rehabilitation programs around the world. It directly targets your quadriceps, the large muscle group on the front of your thigh. Your quads are the primary supporters of your knee joint. When they are weak, your knee absorbs far more stress with every step you take. When they are strong, they act like a built-in shock absorber, protecting the joint itself. Strengthening your quads is one of the single most important things you can do for long-term knee health. Here is your setup. Sit in a sturdy chair with your back flat against the backrest. Your feet should be flat on the floor, about hip-width apart. Sit tall and do not slouch. Your thighs should be roughly parallel to the floor with your knees bent at about 90 degrees. If the chair is too high and your feet dangle, place a folded towel under your feet. If the chair is too low, switch to a taller seat. Now here is the movement. Choose one leg to start with. Slowly straighten that leg out in front of you by tightening your quadriceps. Think about contracting the muscle on the top of your thigh and gently pushing your kneecap upward as the leg extends. Straighten the leg as far as you comfortably can. You do not need to lock it out completely. At the top, hold for 2 full seconds and squeeze the quad firmly. Then slowly lower your foot back to the floor over a count of 3 seconds. Do not just let it drop. That slow, controlled lowering is where a great deal of strengthening actually happens. Exhale as you extend the leg. Inhale as you lower it. For beginners, aim for 8 to 10 repetitions on each leg, 1 set per side. Rest for about 30 seconds between legs. As this becomes comfortable, add a second set or increase to 12 to 15 reps. Common mistakes include swinging the leg up with momentum and leaning backward as you lift. Keep the movement slow and controlled, and stay tall with your back against the chair throughout. If this feels too difficult, reduce the range of motion and extend only halfway. You are still working the quad effectively. For progression, add a 1 to 2 pound ankle weight or a light resistance band around your ankles. Here is the pain rule for every exercise today. Muscular effort and a gentle burn in the working muscle is perfectly normal and a good sign. Sharp pain inside the knee joint means stop, reduce range, or consult a professional. Muscle effort is welcome. Joint pain is a signal to back off. Exercise number 4. Wall sit. Wall sits are frequently included in knee osteoarthritis rehabilitation programs and widely recommended in clinical exercise therapy. This is an isometric exercise, meaning you hold a position rather than moving through a range of motion. That makes it especially valuable for sensitive knees, because you build significant strength with minimal joint movement, which often means much less discomfort. It targets your quadriceps heavily while also engaging your glutes and core for overall lower body stability. Setup. Stand with your entire back flat against a smooth wall. Walk your feet out about 18 to 24 inches from the wall. Feet hip-width apart, toes pointing straight forward or very slightly outward. Press your shoulders, mid-back, and lower back firmly into the wall. Movement. Slowly slide your back down the wall by bending your knees. The critical point is that you do not need to go deep at all. For most people over 50, a shallow bend of 30 to 45 degrees is perfect and highly effective. Your knees should stay directly above your ankles. If you look down, you should see your toes in front of your knees. Do not let your knees push past your toes. Once in position, hold and breathe steadily. In through your nose, out through your mouth. Do not hold your breath. You should feel strong effort in the fronts of your thighs. Beginners hold for 10 to 15 seconds, 3 holds total with 30 seconds rest between. Over time, increase to 20 seconds, then 30, then 45 seconds per hold. Common mistakes are going too deep too soon and letting the knees cave inward. Keep knees tracking straight over your second and third toes. Easier option. Slide down just barely. Even unlocking the knees will activate the quads. Progression. Slide slightly deeper over weeks, increase hold time, or place a light band above your knees and press outward during the hold to also work your hip stabilizers. Exercise number 3. Standing hip abduction. This exercise is commonly used in physical therapy for knee pain because hip strength directly affects knee alignment. Your gluteus, medius, and minimus muscles on the outside of your hip control how your knee tracks during walking, climbing stairs, and standing up from a chair. When these muscles are weak, your knee tends to collapse slightly inward with each step, creating extra stress on the joint surfaces. Strengthening your hip abductors keeps the knee properly aligned and reduces that harmful stress over time. Setup. Stand next to a wall or behind a sturdy chair with one hand on it for balance. Stand tall, with feet together, weight evenly distributed, shoulders back, chin level. Movement. Keeping the standing legs slightly soft, slowly lift the other leg straight out to the side. Lead with your heel rather than your toes. This detail is important because leading with the heel engages the correct hip muscles. Lift only as far as you can while keeping your torso completely upright and still. For most people, this is about 12 to 18 inches off the ground. Do not lean your body to the opposite side to lift higher. Hold 1 second at the top, then lower over 3 seconds with full control. Exhale as you lift. Inhale as you lower. Beginners aim for 10 reps per side, 1 set. Build to 12 to 15 reps and eventually 2 sets per side. Common mistakes. Rotating the hips so toes point to the ceiling during the lift. Keep toes pointing forward or slightly downward, swinging the leg instead of using controlled movement. Easier option. Reduce the lift to about 6 inches. Progression. Add a light resistance band looped around both ankles. This exercise also greatly improves your everyday balance and stability, which is a significant benefit for daily life confidence. Exercise number 2. Standing calf raises. Calf raises are widely recommended in clinical exercise programs for lower limb strength and knee support. Your calf muscles, the gastrocnemius and soleus, help control ankle stability, and when your ankle is stable, forces traveling up through your leg to your knee are much better distributed. Weak calves mean your knee compensates by absorbing extra impact it was not designed to handle alone. Strong calves share that load effectively and improve your overall steadiness during walking, standing, and stair climbing. Setup. Stand behind a sturdy chair with both hands resting lightly on the chair back for balance. Feet hip-width apart, toes pointing forward, posture tall, core gently engaged. Movement. Slowly rise up onto the balls of your feet, lifting both heels as high as comfortable. Think about pushing the floor away with the balls of your feet. Hold 1 to 2 seconds at the top, feeling the contraction in your calves. Then slowly lower your heels back to the floor over 3 full seconds. Do not just drop down. The slow lowering strengthens the calf through its entire range and works the muscles and tendons around your ankle. Exhale as you rise, inhale as you lower. Beginners aim for 10 to 12 reps 1 set. Rest 30 seconds, then add a second set when ready. Build toward 15 reps and 2 to 3 sets over several weeks. Common mistakes. Rising onto the outside edges of the feet. Push up evenly through all 5 toes. Rushing the reps. Maintain a 2-second rise and 3-second lowering every time. Easier option. Perform calf raises seated in a chair, feet flat on the floor, raise heels while keeping toes down. Less load but still effective strengthening. Progression, single leg calf raises. Lift one foot and rise on one leg. This doubles the load and challenges balance significantly, so hold the chair securely. Exercise number 1. Seated knee flexion and extension for range of motion. We finish with this because maintaining your knee's range of motion is absolutely fundamental to knee health. It is commonly the very first exercise physical therapists prescribe for any knee issue. When your knee gets stiff, it changes how you walk, stand, and climb stairs. Those altered movement patterns create extra stress on your hips, ankles, and lower back as well. A knee that moves freely through its natural range feels better and functions better in every daily activity. Setup. Sit in a sturdy chair with your back supported, both feet flat on the floor, knees at roughly 90 degrees. Movement. This has 2 parts. First, slowly straighten one leg out in front of you, extending as far as comfortable. Hold for 1 second at the top. Second, instead of just dropping the foot back, slowly slide your heel underneath the chair as far as it will comfortably go, bending the knee deeply. Hold 1 second in the bent position, feeling a gentle stretch around the knee, then slowly extend forward again. That complete cycle is 1 repetition. Take 3 seconds to extend and 3 seconds to bend. Breathe continuously and evenly throughout. Beginners aim for 8 to 10 reps per leg, 1 set per side. Build to 12 to 15 reps and add a second set over time. The most important rule is to never force the range of motion. If your knee does not fully straighten or does not bend deeply right now, that is completely fine. Work within your available pain-free range. With consistent practice, that range will gradually and naturally improve. Avoid rushing this exercise. Speed defeats its entire purpose. Easier option. Reduce the range in both directions and move through whatever arc is comfortable. You can also do this lying on your back in bed, sliding your heel along the mattress, which removes gravity and makes it much gentler. Progression. Add a very light ankle weight for extra strengthening. This exercise is especially valuable first thing in the morning when your knees feel their stiffest. Even a few reps before getting out of bed can make a real difference in how your knees feel all day. Now, here is your simple routine combining all 5 exercises. Warm up. March gently in place for 1 to 2 minutes or walk around your home. Easy, comfortable movement to get blood flowing. Then perform in order. Exercise 5. Seated knee extension, 8 to 10 reps per leg. Exercise 4. Wall sit. 3 holds of 10 to 15 seconds. Exercise 3. Standing hip abduction, 10 reps per leg. Exercise 2. Standing calf raises, 10 to 12 reps. Exercise 1. Seated knee range of motion, 8 to 10 reps per leg. Rest 30 seconds between exercises. Total time is about 10 to 15 minutes. Frequency. 3 days per week with at least 1 rest day between sessions. Progression timeline. Weeks 1 and 2 focus on form and pain-free range with beginner numbers and no added resistance. Weeks 3 and 4, add a second set or 2 to 3 extra reps, but not both at once. Increase wall sit holds by 5 seconds. Weeks 5 through 8, add light resistance. Band for hip abductions, ankle weight for knee exercises, single leg calf raises. Golden rule. Change only 1 variable at a time. If adding reps, do not also add resistance. 1 change at a time lets your body adapt safely and helps you identify what works best. These exercises are simple, but do not mistake simple for ineffective. The simplest exercises done consistently and correctly are exactly what create real, lasting change in how your knees feel and function. You need a chair, a wall, 10 to 15 minutes 3 times a week, and patience. Give this routine an honest effort for 4 to 6 weeks. Many people begin noticing meaningful improvements in comfort and confidence within the first 2 to 3 weeks. If this was helpful, subscribe to the channel for more exercises designed for adults over 50. Share this video with anyone you know who struggles with knee pain. It might be exactly what they need today. Thank you for watching, and I will see you in the next one. Take good care of those knees.